Okay, so thank you for joining this webinar on preparedness. I'm David Rizzi, the GNC Coordination Help Desk, and I'll start this webinar presenting the freshly finalized Preparedness Guidance for Nutrition in Emergency Coordination, which I've shared with all of you at the end of last week. It's still a draft, so please don't share it further. But should be 95%, the final version. With me presenting today, there will be Antene Tobamo, who is our GNC, RRT, NCC, lots of acronyms for one person. He'll step in at some point for a case study on risk analysis and monitoring in Afghanistan. And last but not least, Cécile Bascan, who will be talking about preparedness in Ethiopia. You will have time to ask questions or make comments or share your experience on preparedness at the end of each presentation, if you wish. The webinar should take more or less 1 hour, and it's being recorded. As I said, it will be posted on the GNC website. I hope everybody can hear me loud and clear. If not, you can use the chat box if you want to send a message. Okay, so let's start. Can you see that? I hope you can see, yeah, the PowerPoint presentation. So I think we can start. I presented the host. So why a guidance on preparedness? I'll start with a citation that I like very much. If I had 6 hours to chop down a tree, I would spend the first 4 hours sharpening the axe. I mean, it's very strong sentence. Citation apart, I think we have made a lot of progresses in the last decades in terms of program quality, coverage, coordination, but we have fallen short when it comes to preparedness. In fact, humanitarian implementing agencies might not consider it as part of their mandate or as a priority. And donors may want to wait, for more evidence of a possible crisis before granting money. So preparedness has often been neglected, which means, we ended up delaying the response. And this has costed lives, of course. And as there were no dedicated guidelines for preparedness in coordination systems, the GNC decided to develop its own for the nutrition sector. Who are these guidelines for? Well, first of all, this is not only for clusters, but for any coordination mechanism for nutrition in emergencies, whether it's a government-based sector, a technical working group, etc. And of course, it's not only for colleagues in the capitals. Many of these actions apply also at local level. Of course, adaptation may be needed based on the context. Like any other guidelines, it can be used flexibly. When to use it? Well, it's important to remind everybody that preparedness is not something you do just before the crisis and then it's over once we start the full-fledged response. Indeed, even in the humanitarian program cycle, preparedness is it's spread across all the phases. So preparedness is a continuous action that should always be in the mind of nutrition cluster coordinators and partners. Moreover, as a crisis develops, it's important also to update the preparedness plans as changes will be needed. This guidance will take you through all the steps needed for preparedness with practical recommendations, plenty of resources, like links to publications, gray literature, templates, samples of tools, so it will make your work much easier. And this guidance is based on existing material and protocols on preparedness, in particular from IASC and from other sectors as well. And of course, we have adapted it, to nutrition in emergency coordination, so with practical examples concerning nutrition. So, like other guidelines on preparedness, it's structured into three pillars. The first one is risk analysis and monitoring. Second is preparedness, the preparedness actions. And the third is contingency planning. So we'll start with the risk analysis and monitoring, which is basically about identifying the risk factors that may lead to a nutrition crisis and attribute to them a likelihood and an impact levels, and monitoring these over time. So usually this is done by OCHA. So you'll just provide OCHA with some figures for the nutrition sector, like the prevalence of malnutrition, the admissions, and OCHA will do this exercise for the whole crisis and all sectors. But in some cases, in particular, for example, when you have a sector coordination, you might need to do it on your own. So let's imagine that you are doing this exercise in your cluster, and there is an agreement that drought is a major risk factor for the nutrition status of population. Koki, I think your mic is on, and I can hear an echo on my. Yeah, thank you. Great. So let's make an example. Let's consider drought as a risk factor for a nutrition crisis. So in this case, let's take only one for the sake of the example. Of course, in a practical situation, and we will see the Afghanistan case in a few minutes. You can consider several risk factors, but let's take just drought. So the nutrition cluster now should estimate the likelihood of a drought of happening on a scale from 1 to 5, and should also estimate the possible impact of this drought, again attributing a value from 1 to 5, because of course the same drought can hit in different ways to a different level of intensity, different areas. So you will have two numbers, the likelihood and the impact, and by multiplying them, then you get the risk level for drought. After this, you have to set a threshold for this level, so that when the risk level becomes too high, goes beyond this threshold, some specific actions may be launched. And most commonly, this is the contingency plan. Now, it may sound a bit complicated, especially over the Skype, but it's not a hard science that should discourage you. Risk monitoring is simply an estimation tool to help you anticipate the consequences of a certain risk and plan for correcting actions in advance, so that you are not taken aback when these become overwhelming. So now that you have identified the hazard, the drought, you have the risk level, which is a number. How do you monitor the risk? So in this case, for example, you may request weekly updates to the food security cluster on the pluviometry, on the weather. And after this, you may also want to develop possible scenario for this hazard. Again, now I'll give the floor to Antene, who has been cluster coordinator in Afghanistan, and he'll present us a case study on risk analysis and scenario building in Afghanistan. Over to you, Antene.
Thank you, David. Thank you, everyone, for joining us this afternoon. I will briefly talk about what we have been doing in Afghanistan when I was there, and it has also continued up to now. As David mentioned, there is a need for analyzing the risk level so that we have some kind of preparedness action and preparedness plan in place. We cannot prepare for everything. We can only prepare for certain hazards which are likely to happen and which may have significant impact. So the way to check the risk level is using the risk matrix. In Afghanistan, what we used to do, and is also now continued, We have 5 zones, which are like the 5 regions of the country. We have 34 provinces. What we do is normally this risk analysis is better be done through intercluster coordination, but unfortunately, the OCHA risk analysis schedule and also the frequencies with which the OCHA does or intercluster group does risk analysis, it doesn't really go with our plan. So we normally do it right at the beginning of the year, and then we review it afterwards during the mid-years at the nutrition cluster. So we don't necessarily have to wait for OCHA, and that wasn't what we were doing. However, as our source of information for the hazard, there is a hazard and a risk profile within OCHA. OCHA normally collects information, records some incidents for years, or sometimes also you can get this hazard profile from Ministry of Health Disease outbreak reports. They actually have a hazard repository in some countries, like I know in Sudan they have this kind of system. FuseNet has information on the drought situation over the years, the climatic situation, maybe a 5-year or more than that. Or you may also have information on the conflict level, the conflict incident. There is a conflict incident database which you can use as a source. So by using all these sources, the cluster coordination team, both subnational and national, and the key partners, they meet and rank certain hazards in terms of the likely impact and the likelihood of happening. So if you can see on the screen here, on my left hand side, probably it could be in your right or left hand side, I don't know, I'm not so sure. You find the vertical, the axis, you see the impact, or horizontal axis, you have the likelihood. In case of Afghanistan, we have about 5 hazards identified: climate, drought, armed conflict, flood, earthquake, epidemic, and some other hazards which were dropped. So among these hazards are identified from the different sources which I mentioned. So the team sits, our coordination team and partners sit and rank these hazards in terms of likelihood in terms of the likelihood of happening, unlikely, likely, very likely, and so on. And then they look at also the impact, whether or not the impact is minimal or is the impact is really quite significant. So the risk is simply the multiplication of the hazard and the likelihood and the impact. So and as you can see, I can take you back to also the risk profile, the risk analysis matrix. Those which are with the high risk level, very high risk, which is like the multiplication is around 20. These are more kind of hazards very likely to happen, imminent to happen, and may have high impact. So for this kind of hazards, what we need to do, look at the last column, we do a contingency planning. There is a clear difference between contingency planning and preparedness. There is, I see there is always confusion. It had been also a confusion among our team members. Contingency planning is for something which is imminent to happen. There is a clear sign that it is very likely to happen and the impact is going to be significantly high. So in that case, you simply work with your team, with your partners, and develop a contingency plan and that's the action which is required in case of high risk situation. And then you have another hazard, which is armed conflict, which is high risk, but a bit lower than the very high risk. In this case, you simply stick to your preparedness plan. As David mentioned, there are minimum preparedness actions. And also in the next slide, I will talk about the scenario planning aspect. Once you identify the risk level, then you have to also put in place a concrete plan with set target, even sometimes in terms of the resource requirement. So in this case, you do more a typical preparedness plan. And then if you look at the hazard, the third hazard, which is flood, is moderate risk, but still you need to have a preparedness. And then also there is a need for frequent monitoring. Things are not static. The situation might change during the course of months. You usually do your risk analysis maybe at the beginning of the year or during the course of the year, but on an ongoing basis, you need to monitor the situation and accordingly review or revise your preparedness plan for the country or part of the country. So as you have seen, hazards, we have different hazards which are applicable to the country in Afghanistan, and then we ranked those in terms of the level of risk, and then also we identified the required preparedness action. It can be contingency planning, it can have a preparedness action, it can have a preparedness action with frequent monitoring, and if it is a low risk, then we continue to monitor the situation and then accordingly revise our preparedness plan during the course of the year. So now, once you have the preparedness plan, the risk analysis for your preparedness plan, in the end, whether it's preparedness or in response, we are talking about people. So in this case, we need to translate the risk analysis into a scenario. What is going to be the likely caseload? I don't know the alternative for term for caseload, but the number of people who are likely to be affected and who will be likely to be in need of some kind of humanitarian assistance. So we need to have that estimate. So in this case, like in Afghanistan, on that particular year, I think this was 2018, there was an estimated 3.4 million people who were likely to be affected by the drought. And then out of this, we estimated around 550,000 would be children under 5, and then almost half of that would be PLNW. So the same thing we did for armed conflict and flood. So basically, we follow more or less a similar approach like the HNO HRP exercise. You do the need analysis, you prioritize, and then you translate that into some kind of plan. The difference is, this one is something which you prepare for. You are, unless the situation really changes and then that hazard happens, you are not going to start to take action. Instead, you make sure that you allocate resources, you put in place the preparedness minimum actions, which David will be talking in the next slides. But you can do prioritization based on the risk level, and then you have also some idea how much the caseload and the estimated affected population will be. So this way, we can do the risk analysis, and then, of course, you can do your scenario planning. So the case of Afghanistan, I would say that is a good example that can be applied to many other countries, as Afghanistan is also a protracted situation with also recurring incidents of, rapid onset emergencies. So the experience from there can also be used in a similar contexts elsewhere. So I will stop here, David, and over to you.
Okay, thank you, Antene. That was very clear and very useful, to explain the theory. But I have to admit that I was looking for examples of the risk analysis and monitoring while developing the preparedness guidelines, and I had 0 replies. Nobody had a single example of this apart from yours, of course. So it's a pity that I don't know whether maybe it seems overcomplicated, but as you showed, it can be done. It's easy, and it's an important piece of work you can do with cluster partners for preparedness. Okay, so let's move to the next slide, which is, so we'll go back to the preparedness guidance now. So we said there are 3 pillars: the risk analysis and monitoring is the first one. The second one is the basic preparedness actions. So these are, let's say, the bulk of the guidance. So these actions should always be done in countries prone to a nutrition crisis, regardless of the current risk level that we've just talked about. Let me repeat this because it's crucial. So nutrition clusters should always do the risk analysis and monitoring, and in parallel they should always do the basic preparedness. Now, it's only when the risk monitoring shows a very high risk level that we set up contingency planning or other advanced preparedness measures. But we will talk about those later. So now we will talk about the basic preparedness, the ones that should always be in place in country prone to risk. And they involve minimal cost or no cost at all. And some or many of them actually are already in place in your countries. Indeed, you as nutrition cluster coordinators, you are one of the best preparedness measures taken, because if a nutrition crisis hits your country tomorrow, you are there to coordinate the response. And there will be no time lost in recruiting someone or training someone and putting in place a coordination system, etc. So what are these preparedness actions, the basic preparedness action we should always make sure we have in place? Well, as you may imagine, there are many, and it's not the purpose of the webinar to list or talk about all of them. Just have a look at the guidance, and you will find plenty of examples and references. I'll now just present, the main ones divided in groups. So we will start with the coordination mechanism itself. So as I said, you as a nutrition cluster coordinators and nutrition cluster, you are part of these preparedness plans already. You have, a clear mandate. You have TORs. You might have, technical working group or strategic advisory group. A contact list of all the partners, a forum where all the partners can actively participate and coordinate the response. So this is all preparedness. With regard to information management, of course, being prepared means having a functional environment for data collection, storage, sharing, having the TORs for the staff who manages these activities, who has clear reporting lines, etc. We have a group about need assessment and analysis. So this is more, of course, nutrition specific, of clear importance. So you want to make sure that need assessments for nutrition will be properly done, that the methods are, correct, statistically sound, and agreed, among all partners. You may play a role in making sure that the resources are available and shared. For example, having a registry of all the personnel who has been trained on nutrition surveys that can be shared across organization. Making sure that tools are harmonized and accessible to everybody. There might be a multi-sectoral assessment also, at the early stage of a crisis, and in that case, you may want to take part to the assessment and agree with the cluster members on what to look for. Then, more advanced preparedness action may include, for example, a screening or surveillance system to monitor the nutrition situation. And don't forget that nutrition is, of course, also the nutrition status of population. The population is a risk factor for other sectors. Imagine health, for example. So other sectors will be monitoring nutrition because it may have an impact on their sector. So it's important that you provide this data. With regard to financial resources, well, you have to keep a good, close relationship with donors present in the country or not. You must be aware of their priorities and timing in fund allocations. And you can support the nutrition cluster members, funding opportunities, in particular on common appeals such as SERF, where the cluster has a direct involvement. In terms of implementation of nutrition programs, so the basic preparedness would include, a mapping, the classic 4W map of who is doing what, where, when, and the corresponding gap analysis, so that if needed, new actors can quickly fill the gaps, or resources can be allocated to the communities that need them the most. Now, you may expect to find here more on preparedness for some specific nutrition programs, such as CBAM or YCFE, but you have to consider that preparedness is not about how to set up these programs, but how to be ready to do so quickly when it's time to do so. Moreover, as GNC, we are developing a nutrition in emergency checklist, and that will help you setting up the programs once the decision is taken. But now we're talking about what becomes before that. Okay, so what can be done? Is there anything that we can do specifically for preparedness for nutrition in emergency programs? Yes, there is. Again, I will not list everything, but for example, it could be obtaining the authorization for importing a nutrition product. Or work with the Ministry of Health to issue a circular reminding of IYCFE guidelines, as you expect a large donation of breast milk substitutes, for example. So there is something you can do at almost no cost. We have done a part on communication and advocacy, which is often quite neglected. So we try to give you some actionable points to design and implement an advocacy strategy for preparedness. I'll give you a couple of examples. For example, advocacy action can be addressed to donors to have more resources for nutrition in emergency, or again to the Ministry of Health to improve inpatient care in hospitals. Again, this doesn't cost anything, it's effective and can get you ready to respond to a crisis. Then we have 2 chapters on accountability to affected population and cross-cutting themes like GBV, disability, resilience. These have been developed in collaboration with our in-house expertise at UNICEF, but they have been adapted to the nutrition cluster needs. So again, you will find here only what you really need, to implement your preparedness, design and implement your preparedness plans. Okay. Now we'll move into contingency planning. So you remember at the beginning we talked about risk monitoring at threshold. So when the threshold is reached, now we enter into the contingency planning phase. Okay, so these are usually activities that requires more resources, which could be funds or staff. Again, OCHA is often in charge of contingency planning for a whole crisis and all sectors. But in some cases, you may want to have your own contingency plan. And in the guidance, we take you through all the steps to develop a contingency plan specific for nutrition in emergency. You will find also the links to the ES templates to develop ACP, as well as a couple of real case examples of contingency planning for nutrition. So contingency planning is meant to address, as Antena anticipated, to address rapidly the most urgent humanitarian needs just before or at the beginning of a crisis. So a contingency plan as a document is not very different from a standard project proposal in its structure. It includes a situation analysis describing the context. So in our case, for example, we can include the baseline or the latest nutrition data and the risk, the risk that we have identified. It contains the objectives that we want to achieve and the response, so the set of actions to achieve them. It includes also information on the way that we are going to deliver such actions, on the coordination system around it, on the existing gaps, and on the resources needed, so the funds. Now, I hear you asking, okay, but what are the common contingency actions that a nutrition cluster can put in place? And this takes to the next slide. So, first of all, we have to consider that the contingency planning is implemented on top of the basic preparedness that we have talked about. You remember the first the second pillar. So contingency plan is a continuation, a strengthening. It adds up to the preparedness measures so far presented. So if there is no basic preparedness, a contingency plan should address first all those actions and build on them more advanced measures. But if the basic preparedness is in place, then the contingency plan will be much more limited in its scope. So contingency plan will include, for example, the strengthening of the coordination mechanism at local level, probably with additional staff. It may envisage the scaling up of the CMAN program in some areas, because now we have stronger evidence that malnutrition levels are increasing. It may include the early procurement or early distribution of supplies to the district or health facilities likely to have more admission. It may include the training or retraining of the staff. So these actions, again, are not very different from the basic preparedness, but as I said, require more budget, human resources, so are only allocated when the likelihood of the crisis becomes higher. And with this, I think we have finished this short introduction of the preparedness guidelines, which I invite you to read. Feel free to send comments. I mean, the document is almost finalized, but we are still waiting for a couple of reviewers and then the proofreading. But if you have any comment or suggestion, we might consider it. So if you have any question for me or Antene, you can speak now. If not, I'll give the floor to Cécile for another case study on Ethiopia.
A question from South Sudan, please.
You're welcome, Herman. Go ahead.
Thanks very much, David and Anthony, for clarifying these key concepts. My question goes to Anthony regarding the risk analysis. I understand that it's normally a cluster initiative bringing together the coordination team and the partners. But I think to ease this approach, it will be good if we can have some sort of standards. So would there be some guidance, be it at regional or at global level, indicating the key information that we should be tracking or collecting or analyzing with regards to each potential hazard? If this is available, would there be guidance on cutoff or thresholds that would allow us to classify the particular hazard in terms of likelihood. Thank you very much.
Right. Thank you so much, Herman, for the question. I would like to mention that the risk analysis example I put, it's applicable. It's also you can find it also intra-agency standing committee emergency preparedness materials, but it is more related to the UNICEF risk-informed programming approach. So that risk-informed programming approach requires UNICEF as a cluster lead agency, be it within UNICEF or through the cluster coordination mechanism, to make sure that in a country level, context specific, I would like to underscore the context specific hazards are identified and the risk analysis done in that particular context. Example, tsunami may be a problem somewhere in a coastal areas. Tsunami may not be applicable to Afghanistan, a landlocked, or it may not be applicable to Nepal. Maybe earthquake may be applicable. Drought may not be an issue in some countries, where there is abundant amount of water all the time. There are big water bodies. So the hazards are more context specific. Some countries have conflicts. They have continuous periods of protracted conflict. So that conflict is applicable in that context. Now, the second part of your question, do we have a threshold for these hazards or the risk level? Yes, we have some indicative, not really specific cutoff point, but it's up to the country team, the cluster partner, to decide, okay, is it really high risk or low risk or medium risk? You can use the risk analysis matrix. But the best measure of threshold is basically in your specific context, how much would be the impact in terms of nutrition? How many children are going to be affected? How many pregnant and lactating women are going to be affected as a result of that particular hazard? So basically, there is no threshold. It is context specific. The same way you do for example, in case of HNO, HRP, you look at your context. Of course, there is emergency level of acute malnutrition, but in the end, the drivers, we are talking about the drivers. And if you take HNO, we are talking about the drivers, and then what will be the nutritional consequence of those drivers. So the hazards are equivalent to the drivers. The drivers can be conflict, it can be drought, natural disaster like earthquake, and then you translate that into what would be the context-specific impact of that particular hazard on nutrition. So it's so I would like to say that this is a context-specific, but of course you look at also, once you identify how many children or women will be at risk of malnutrition, and then you look at, okay, within that particular area, what is the maybe the prevalence of malnutrition? Is it emergency level in a pre-crisis situation? And then of course you do that specific analysis in your context. I don't know I fully or partially responded to your question, but the whole idea is that you need to make this more context specific. In some cases, you have to even apply it to a certain part of the country. Over.
Yeah, thank you, Antene. If I can complete you, well, I totally agree with you, and indeed, not only the hazards, they can apply to some countries and not to others, but the same hazard in the same country can have a different impact. let's take, for example, the drought. Okay, can severely affect people who are totally dependent on subsistence agriculture, but it may have a much lesser impact on nomadic people who can move to areas that are not affected. So of course it's almost impossible to put in a sort of standardized guidelines for all the possible hazards, etc. It's really up to the nutrition cluster coordinators and partners to discuss these issues. And on the second question about how to get some threshold reference points, the suggestion is to use the historical data that you have available in your country. Those are the best possible way that you can use to predict how bad the situation will be in the future, how likely it is to happen. So often, we don't have enough, sufficient quality data, but try to see how things evolved in the past when, for example, the same drought has affected the same region, and probably that can lead you to identify, appropriate thresholds. Okay, any other question?
Well, maybe a probing one. I fully understand what you are saying. It's a context-specific approach. But what I was trying to find out is that for a given context, let's say I am in a drought-prone context, what are the critical information that I should be following up for the risk analysis? It may be, for example, looking for meteorological data. It may be, for example, looking at data concerning the weather trends. It may be information regarding the rainfall patterns over the past years, and so on and so forth. I think that's the kind of information I'm talking about for each particular context, for each particular potential hazard.
Can I?
Yeah, sure, go ahead.
Herman, yes, there are in-country sources, some also global sources regarding the hazards that affected that country. So you go back historically, and then you check whether that particular hazard happened in that country. For example, even earlier on during my slide presentation, I mentioned about, for example, the weather hazard, as you rightly mentioned. You could look the meteorological data. You can have national sources on that. Also, you can have information from the relevant clusters. For example, food security they are better placed in terms of monitoring those kind of information. As I mentioned also, OCHA normally keeps a record of this kind of hazards in the past. I think the good OCHAs, if you have a really working OCHA in your country, you can go and ask them, what has been, the historical record of these events. If you are in a conflict-affected country, there is a conflict incidents monitoring database, which I think some of these sources I can also share. So you go back to that, and then you look at historical incident data of maybe 5 years or so. If you are talking about flood risk, you can have also that information from national disaster management authorities, how many years, like 5-10 years history of the incidence of those kind of hazards. So these are examples of source of information, but it's up to us to be proactive and find out the most appropriate and relevant source. So it's up to us to expand that source of information.
Okay.
Thank you.
All right. All right. Thank you very much once more.
Yeah, indeed. I mean, we're talking here about many possible hazards from civil conflicts, which requires expertise in security, to drought, which requires expertise in meteorology. So, of course, we are not supposed to be expert in all of this. So, the best thing you can do is to outreach for qualified expert advice on the topic. And the first try, I would say, is the other clusters, if this expertise is available. Okay, and any other question, comments?
David, can I come in?
Yes, sure.
Yeah, this is Alam from Sudan. How are you? Hello, can you hear me?
Yeah, very good, very good. Yeah.
Good.
Go ahead.
Actually, in theory, if we are working on a single hazard, that makes sense that we have a preparedness plan at the national level. But in a context like Sudan and South Sudan and others, I think the question is still pertinent. How are you going to go around the multi-hazards? Is it not one plan fits all? So you need to have, the question is that whether you need to have an individual plan for each hazard and each geographical area, and what your experience tells us that how we go around that, because that means a hell of a work is going to go at decentralized level, fixing each regional conflict, our flood, our disease outbreaks, our the other risk factors, the hazards and risk factors which are involved around the preparedness. And that's the question around the ministry, because we do a single national preparedness plan, but when it comes to the regional issues, each context has a different kind of preparedness and mitigation measures required. So what does the experience from, and probably colleagues can jump in if they like to, but it's for a coordinator to deal with almost 10 to 15 hazards in different regions across the country, and then come up with a single consolidated response plan which should address all the hazards, is a little bit difficult and challenging undertaking, actually.
Okay.
Yeah, thank you very much, Alan, for the valid question. Indeed, yeah, it may seem an overwhelming task, but I think the way this methodology has been designed is exactly to help you drive through all these possible risk in terms of likelihood, impact, affected population, and come up with priorities. Of course, as a nutrition cluster coordinator at national level, this is at a risk monitoring and analysis countrywide. So if you do this exercise and you have the likelihood, the possible impact, and you multiply them, then the first one would be those that where you put more of the effort. You cannot waste your time or the time of partners on very small scale crisis affecting very few people or not high intensity of those. You should discard them. Probably you should not even consider for your analysis. But for the others, those that might have a significant impact at national level, through this exercise, through this methodology, you can rank them, and so your efforts will be put mostly in the first ones. I don't know whether I ask your question.
Can I add just a point on David?
Yeah, sure, go ahead.
Yes, I mean, as you rightly said, there is a need for prioritization. I mean, the reason why we have this matrix is to prioritize the ones which are more likely than the least likely. Well, also, as Alam mentioned, some countries have a number of hazards, and in that case, he said that it may be an overwhelming task, to prepare for everything. I think if I can give example from Afghanistan, or it can also be applicable to elsewhere. Well, the hazard is like conflict is an ongoing hazard in Afghanistan, but you don't have to prepare for everything that is induced by conflict, including displacement. part of it is already covered by the humanitarian response plan. Here we are talking about anything in excess of the existing response plan. So what if the conflict situation is likely to deteriorate further and the scale and the coverage of the conflict is expanding, or something which is expected than that normally happens, if it is likely to occur, then that's where our preparedness should be focusing on. So in most of these countries, like for example in South Sudan or in Sudan, we have HRP, which basically is the caseload estimate is based on what is expected to happen during the 12 months period of the HRP. So when we talk about the preparedness or even the contingency planning, we are talking about anything in excess of our normal programming, whether it's humanitarian or development. So that I think what I was talking about was in that context.
I think that clarifies a lot, because we do needs overview in preparation, and we do consider the risk factors.
Yeah.
And in terms of both South and North Sudan, we do take care into account all the hazards as part of the needs overview and humanitarian response planning.
Yeah.
So
anything in excess of that. Yeah.
So means the only thing which we don't, I don't know, it's everything above the earth and below the sky is in part of the HRP and HNO here. But so
hello, Koki here, South Sudan, if I may come in.
Yes, please.
Yeah, so I think my understanding earlier when we you had sent the draft is basically what you've just mentioned, that in terms of preparedness, other than other actions that you have put forth, like the staffing, TORs, TWG, is that the annual planning, the HRP, is essentially one of the preparedness plan. And contingency planning basically would be the other additional, probably unforeseeable factors or risk factors that have not been well spelled out, especially in the HRP. Probably the much interest we have for South Sudan is because we want to develop a contingency plan, and what we are envisioning as the pathway to doing this is basically looking at our HRP and looking at what risk factors are included there that have not been addressed. 2019 has been one of a very interesting year for us, particularly having floods occurring every year in South Sudan. But then we did not exactly probably plan for it in terms of having a contingency plan and mapping out the areas that would be affected and the impact, and being able to prepare properly for the unforeseeable floods, which were in excess than other years. So essentially what we are going to be doing is we want to develop the contingency plan based on the factors that were not considered probably in the 2020 HRP. And then with that, you're going to be having, I imagine that we'll have the bigger contingency plan at the national level, but then again, develop kind of a guidance or a guidance or a template that will also guide some of the regional issues that what Alam is raising, that would be more, more specific context kind of risks that are available in some areas that would not have been addressed properly, particularly at the national level. I don't know what these risk factors would be, because it's becoming quite interesting when you look at the risk factors and the disease outbreaks following the floods, other things that probably we did not foresee very well, particularly in the 2020 HRP. And with that, then I was asking, do you have contingency plans that have been developed alongside HRP that we can actually look at and learn from them?
Yes, David, can I come in?
Yeah, sure. We are a bit late, but yeah, go ahead.
Yeah, the contingency plan example I can share from Afghanistan, and we'll search from other countries. I can share like a typical drought contingency plan, which was done alongside HRP. So we can share that. But one more point I would like to add is, I'm sure you understand that we are not trying to be really prescriptive in terms of the type of hazardous or, you know, the threshold or whatever. This is more of the principle in which we need to approach in our specific context. So in your case, South Sudan, obviously, from disease outbreak, localized to a massive conflict, everything is there. But it's up to your clusters and partners. By the way, partners are actually an important source of information, including the hazards, because you have partners who have been there for years. They know what happened, what is going to happen, and the likely impact of that. So it is, I would like to say it's context specific. Here we are talking about the general principles, and then the fact that it shouldn't be confused with the HRP. HRP handles based on the need analysis you do, and there is also some element of also forecast. But anything in excess of that, which is, I'm not saying anything under the sun, but at least the ones which reasonably are likely to occur and have impact on nutrition in your context. I'll stop here. Thanks.
Okay, thank you, Anten, everybody. So I'll give now the floor to Cecile for a case study on Ethiopia. Cecile, are you there?
Yes.
Okay, the floor is yours.
Okay, thank you very much, David, and hi, everybody. We're a bit late. I need 10 minutes to tell you a little bit about how we go about emergency preparedness and response here in Ethiopia. And I'm going to start with a little bit of background by telling you that, as you may know, Ethiopia is a country where malnutrition is a very significant public health issue. We have several forms of undernutrition. All the underlying causes and root causes of malnutrition are coming into play in this country. And the country faces recurrent risks, shocks, that are further exacerbating those existing vulnerabilities. So we have floods, drought, intercommunal conflict and political tensions, recurrent disease outbreaks, you name it. And this year, there will be also a general election in August, and we are preparing for, unfortunately, likely civil unrest that will lead to large-scale population displacements. And we are preparing for this. I will try to tell you a little bit about this. So I need to tell you a little bit about the humanitarian structure and governance. If we could switch to the next slide, David, please. Yes, so the government of Ethiopia is very strong government with several institutions playing a role in different aspects of emergency preparedness and response planning. We have the National Disaster Risk Management Commission, or DRMC, and DRMC with emergency coordination mandates, both federal and subnational level. FMOH, of course, with in charge of delivering the healthcare and nutrition services. By the way, here the NGO partners can not do direct service delivery and are providing a technical support to the health system. We also have the Ethiopian Public Health Institute, EPHI, in charge of disease surveillance and some capacities to deploy some rapid response team, but they respond more to public health emergencies, very much engaged into coronavirus emergency preparedness at the moment, but I will not talk about this now. And then, yes, in Ethiopia, we have the cluster approach is activated since 2010, and the nutrition cluster is integrated into the Emergency Nutrition Coordination Unit of NDRMC. Next slide, please. So we have in this country some good national guidance. There is a national DRM policy with long-term resilience building goals that was supposed to be declined at sub-national, local level, district level, called WOREDA here. So we were supposed to have WOREDA level risk reduction plans and contingency plan in disaster-prone areas, but this was not executed. And so in Ethiopia, it's a bit like this, humanitarian responses are still delivered a little bit on an ad hoc basis, if I may say. We're in a reactive mode, and the responses to those recurrent shocks could be more effectively anticipated. So now I'm going to have a few more minutes to point at some strengths and also weaknesses to reflect on. So a big strength in Ethiopia is the fact that we have very well established arrangements for coordination. So the NDRMC can, at times of crisis, activate emergency operation centers or EOCs at a federal and a regional level that are supported by OCHA and works a little bit as an ICCG, and they have their sector-specific task force as well, or command post, and this is clearly was seen as an enabling factor to a more timely and well-coordinated response, for instance, at times of, in 2017, when we had a large cholera outbreak in Somalia region, the activation of those emergency command posts was very important. Next slide, please. Talking about other elements of preparedness and response, here in Ethiopia, we have fairly good assessment capacities. We have system in place to do MWAC screening, rapid nutrition assessment, nutrition smart surveys, but we lack a little bit of this a more formalized nutrition surveillance system per se, and so there are delays in actually identifying when the nutrition situation deteriorates and leads to peaks of malnutrition, for instance, and so delays in responding to those peaks. We have also mechanisms and tools like the so-called hotspot WOREDA classification to identify districts of most concern, and we also have the 4Ws to identify where are the gaps in responding to those needs, but we need more flexibility in reprioritizing sometimes the support we provide to the nutrition service delivery in light of those different shocks that are happening. On programmatic aspects, the management of SAM has been integrated into the health system since 2008 and gradually scaled up. It is almost available nationwide now, and is seen as a very important foundation onto which we can build upon at times of crisis for type of surge mechanisms, but we have still limited capacities for a rapid scale up of the CMAM services, and then in establishing those type of CMAM surge kind of approach, and then scaling back down the support when the situation improves. And to talk a little bit more specifically on nutrition and emergency preparedness and response planning, well, we have nutrition elements reflected in many different documents, in OCHA-led contingency plans, all the work done by UNICEF on EPR planning. Various partners have elements of nutrition in those plans, but they're often a little bit vague, if I may say, and also there is often a disconnect between what the emergency preparedness efforts that are done at federal level versus what is actually implemented at times of crisis at local level. So for instance, last year, we know that we have floods happening in parts of the country. So at federal level, under the lead of OCHA and jointly with NDRMC, we developed a flood contingency plan. But when the floods actually occurred in Somali region, the regional authorities eventually did not take into account the contingency plan, and they developed their own response plan. Also, yeah, I think we, coming back to the fact that we have election coming in this country, we have developed also with the leadership of OCHA at federal level an election contingency plan into which we identified some minimum preparedness activities, more specifically to nutrition, that needs to be done and undertaken in the next few months. And among them, we will organize nutrition in emergencies training tied to nutrition EPR planning exercise, so that those events are organized jointly with NDRMC, FMOH, EPHI, all the nutrition cluster partners, including FMOH staff from the regional, subnational level, and hopefully we can come up with more tangible and actionable EPR plans, a little bit into what Anteneth described earlier for Afghanistan. And yeah, that's it. I stop here. Thank you.
Thank you, Cecile. A very interesting presentation. Is there any question or comment for Cecile? I take that as a no, and so with this we can close the webinar. As I said, it will be uploaded on the GNC website. So thank you everybody for your participation, and have a good evening. Bye.
Thank you. Bye-bye.